you got to remember it was in the 1960s when the Surgeon General first determined that cigarette smoking was deleterious to your health.
Right.
Prior to that, in the 30s and 40s, doctors were prescribing smoking cigarettes for various diseases. But really, over the last 20 years, it's been proven time and time again. To give you an example, in the 1900s, the early 1900s, lung cancer was non-existent in women because they weren't smoking.
Okay.
And by 1970, lung cancer surpassed breast cancer as the major cause of death in women in the United States from cancer. So it's clear that cigarette smoking causes cancer, and not just lung cancer, cancer of the head and neck, cancer of the throat. You won't have a patient with bladder cancer unless they have unless they smoke cigarettes.
Really?
Because the metabolites of the cigarette smoke, of the 7,000 poisonous chemicals that occur from combustion of the tobacco, end up in the bladder, and that's really the cause of bladder cancer. Bladder cancer, GI cancer, many different cancers occur with smoking. Osteoporosis, big problem in mostly women, is hastened with cigarette smoking. Sexual dysfunction, cigarette smoking. Immune abnormalities. People get not only infections in their lungs, but they'll get infection anywhere, and their immune system won't be able to fight it if they smoke cigarettes. So there's lots of things that are associated with cigarette smoke besides just cancer. Cigarette smoking causes COPD, causes emphysema, chronic bronchitis, makes asthma worse. It causes heart disease. Every time a person lights up a cigarette, they run the risk of having a heart attack.
Wow.
Because the nicotine in the cigarette will cause constriction of the arteries that supply the blood to the heart.
Okay.
So there's lots of reasons not to smoke.